For the chief complaint, Ms. Brown is a 58-year-old woman presenting with shortness of breath for 3 weeks. So Ms. Brown has a history of hypertension, type 2 diabetes, and hyperlipidemia, who was brought to the ER at 2 o'clock in the morning this morning by ambulance because of sudden onset of severe shortness of breath. She first noticed she was having a problem 3 weeks ago when she noted increasing shortness of breath when completing household chores and walking up steps, and began sleeping on 2 to 3 pillows at night. This continued until 2 a.m. on the day of admission when she woke up after it acutely worsened. Her husband noted that she was breathing rapidly, was only comfortable sitting upright or standing, and was slightly blue in color, so naturally he called 911. She received oxygen in the ambulance along with some nitroglycerin, aspirin, and Lasix in the ER when she got here, and now she's feeling a little bit better. Ms. Brown denies a history of asthma. She denies pleuritic chest pain. She does not have had any fever or weight loss. She has noticed a non-productive cough for several weeks, though. She has a prior smoking history but stopped in 2006. Her father had an MI at age 54. She denies sick contacts or unusual travel. She was diagnosed with type 2 diabetes 10 years ago and is currently on metformin and glyburide. Her past medical history is notable for hypertension, diagnosed in 2004, diabetes, which I already mentioned, diagnosed in 2003, and hyperlipidemia 2004. Her surgical history includes an appendectomy in 1977 and a cholecystectomy in 1998. Her OBGYN history is notable for her being G3P3, and she is status post a hysterectomy in 2008. Her psych history is notable for multiple episodes of depression, but she currently denies any symptoms of that. Medications include HCTZ, lisinopril, metformin, glyburide, Zocor, and aspirin. She's allergic to penicillin and iodine. Social history is kind of interesting. She's notable, she quit smoking 6 years ago. She's drinking 1 to 2 alcoholic drinks per day, sometimes with a glass of wine, sometimes a mixed drink. She's married, mother of 2. She completed her associate's degree at De Anza College and works full-time as administrative assistant for Cisco Systems. She's got 2 dogs at home, but no other strange animals or animal exposures. She enjoys movies and knitting. Her dietary habits are pretty normal. She usually cooks for herself, doesn't eat out for all that much. She's sexually active with 1 partner, her husband. No travel except a recent trip to Disneyland with her children. On her view of systems, she denies fever, chills, weight loss, or change in appetite. In the respiratory system, as already mentioned, she reports the shortness of breath with exertion and lying down. Cardiovascularly, she denies chest pain, palpitations, lightheadedness. In the abdomen, she has no pain, nausea, vomiting, or changes in her bowel habits. No dysuria or hematuria. No joint pains or joint swelling, but she has had some swelling in her ankles during the past 3 weeks. No skin rashes or bruises, and no neuro symptoms. In general, on exam, she is overweight and in modest respiratory discomfort. Her pulse is 100 and regular. Respirations are 24, blood pressure 130 over 105, temperature 37.1. HEENT exam shows her pupils are equally round and reactive to light. Sclera are anecteric. She's got normal extraocular muscles. Oral pharynx is clear with good dentition. Fundoscopic exam is unremarkable. Pulmonary, her lungs have occasional crackles, but no rhonchi or wheezes. On heart exam, she has a regular rate and rhythm with a displaced PMI and normal S1, S2. She had a loud murmur that was systolic. I'm not really sure how to grade it, but I suppose since I could hear it, it's probably at least a 2 or 3 out of 6. Abdomen is protuberant, soft without tenderness, no organomegaly, and normal bowel sounds. Her skin shows no rashes, ecchymoses, or other lesions. Extremities with 1+ pitting edema, with no cyanosis or clubbing. I did a really thorough neuro exam. I wanted to really kind of practice that today. So she's oriented ×3. Cranial nerves 2 through 12 are intact. Her motor strength is 5 out of 5 in all extremities in all major muscle groups. Sensation to light touch and proprioception and vibration, all that's intact in all extremities. Her upper extremity reflexes are 1+, and lower extremity reflexes are 2+. I didn't get her to walk around because she was looking kind of uncomfortable and still from the breathing issue, and she had a lot of wires on her and stuff. So moving on to her labs, her white count was 8,700. H&H is 12 and 37. with an MCV of 85. Her platelets are 202. Her Chem7 shows a sodium of 141, potassium 3.8, chloride 102, bicarb 28, BUN 24, creatinine 1.1, and glucose 186. Her AST/LT are in the 40s. Her total bilirubin was 1.2. Alk-Phos was 110. Troponin is still pending. I'm not really sure why lab's taking a while on that one. INR is 1.1. The UAH has no white cells, no red cells, no leukoesterase, 2+ protein, no ketones, 2+ glucose, and no bacteria. Her chest X-ray shows cardiomegaly, pulmonary vascular redistribution. She had some fluid in the right costophrenic sulcus, and possibly some curly B lines, but I'm not really sure. Her EKG shows sinus tach, occasional PVCs, left axis deviation, and LVH. So in summary, Ms. Brown is a 58-year-old woman who has a history of hypertension, diabetes, and hyperlipidemia, who's now presenting with shortness of breath for 3 weeks and some lower extremity edema.